So some of the things we see coming into the emergency department from cold stretches include exposure, and exposure can range anything from just being cold, chilled to the bone, as they used to say, to something we would call medically related coldness or hypothermia. Hypothermia is one of those things that when patients get exposed to cold temperatures for a long period of time, it goes through certain levels of injury patterns to your extremities, usually your fingers and toes. And the first level of hypothermia would include redness to your fingers or toes, very cold, painful, tingling, numbness, things like that. It can progress pretty quickly to the second degree, which would include blistering, and then the more severe episodes, which include tissue death. What actually happens inside of there is that the water from inside your body freezes and it crystallizes and causes cell damage. The best thing you can do with that or any other cold is to get out of the cold and not expose yourself. So there are things people can do to prevent injury from cold temperatures. Simple things like covering up. You always want to wear a hat, you want to wear gloves. You'll see people run into this situation when they don't expect to run into this situation. So they're driving in their car and they run out of gas, or they slide off the road and they can't get the car unstuck. And they didn't expect to be exposed because they're inside of their car, but they're not prepared. So they don't have hats, they don't have gloves, they don't have multiple layers of clothing, they don't have good shoes to be able to walk in. And so being prepared is 9/10 of the situation. So if you have to go out, you want to keep yourself covered. Covered in layers are best. So if it happens to warm up, you can take some of those layers off, or if it cools down, you can layer yourself back up again. That's one of the best things you can do to protect. If you happen to be in that situation, get yourself out of that situation is really the best thing to do. I'm sure all the time we remember as kids running around outside and being cold, and your nose is a little bit red and your fingers felt a little bit cold. You know, that's a touch of hypothermia. And so what do you do with treatment? You don't have to go run into the doctor every time you have just a little bit of that. So we're talking about sort of first degree. It's a little bit red. It's a little bit sore, kind of tingly. Get yourself out of that exposure. Take off that wet clothing. That is the best thing that you can do. Once you take off that wet clothing, dry yourself off and get yourself re-equilibrated to a normal temperature. So when you bring the kids in, bring them inside, take their wet clothing off, dry off any areas that are cold, and go ahead and expose them to the warm temperature. You don't want to too rapidly rewarm. You're not going to dunk it in hot water or anything like that, because that would then cause injury from the higher temperatures. Let the temperature come back up. If you have to run a little cool water over top of it to make them feel a little bit better, that's okay too, but make sure you dry it and keep your hands nice and warm. Sit next to a fire, or just warm yourself up in a blanket can go a long way. So there's a couple of things that people had more severe hypothermia, whether it be second or third degree. You'll notice some findings. The pain will be severe, something that you really can't handle, and that's kind of a sign that you may be having some tissue damage. Probably worth getting checked out. Clearly blistering on the skin is something there. If you have skin that's changing colors and it's not changing back, a little bit of redness is okay. Dark color, black color is not okay. That would be significant injury related to it. But if you're having pretty severe pain up into that point, one thing that is relatively unique to lower temperatures is the exposure to carbon monoxide. You'll see that in a couple of different situations. People will be in their garage and they'll turn on their car because they want to warm it up, but there's no ventilation. And your car produces carbon monoxide. It's an odorless gas, it's a tasteless gas, and it can very quickly overwhelm you. You'll get dizzy, you might get lightheaded, you may get confused, and so very quickly when you get dizzy, lightheaded, and confused, you may fall down. You may have situations where you can't get yourself out of that carbon monoxide poisoning, and bad things can happen from that. So not only the car, but also from heaters and from fireplaces.